Today is a very happy day for me. The sow is about to give birth to her first litter of piglets, and the previous batch of pigs, raised for more than 5 months, are also being sold en masse. Just early in the morning, my house was already very busy. 3 men came to catch the pig and take it away. The average weight of this herd of pigs is probably more than 100 kg. Every pig is white and pink, plump, and has no diseases at all. To get today's results, I spent a lot of effort, staying up late and waking up early to take care of them. If I have enough money to sell this generation, I will buy a few more household items and take care of my children's education. In the field of animal husbandry, there is a saying, breed is the premise, food is the basis. Care and nurturing techniques are the decisive factor. So to be able to raise pigs with delicious and guaranteed meat quality, there are 3 factors. The above factors are prerequisites that need to be managed and tightened to achieve the goal. In my hometown, when pigs are raised for 5 to 6 months, they will reach a weight of about 100 kilos. This is the time when the meat quality is the most delicious and beautiful. Continuing to raise pigs longer will not be beneficial because feed efficiency begins to decrease. Pigs tend to accumulate a lot of fat, making the meat not as delicious as before. Pig farming time is usually divided into 2 stages. Each stage will have different nutritional standards. Pigs are raised from 105 days old and have an average weight of 60 kilos. This is the period when the body develops the skeleton, muscle system, and nervous system. So the diet needs a lot of protein, minerals, and vitamins to develop both body length and height. Lack of nutrients during this period will cause the skeleton to be underdeveloped. The muscle system will not develop. The pig will become shorter, have less meat because of small muscles, and fat accumulation in the later stages will be more. Excess nutrients will increase livestock costs. Excess protein will be excreted in the form of urea, polluting the environment. Pigs are susceptible to arthritis and premature fat accumulation. In addition, excess protein will cause some digestive diseases in pigs. Before the buyer left, he asked me to spray clean the pigs, and I happily agreed. After the pig truck leaves the house, I also have to check the situation of the mother pig about to give birth. This is the mother pig's first litter. So many dangerous situations can occur that require someone to be on duty to provide constant support. Custom. Detecting pigs about to give birth will be based on the breeding schedule to calculate the pig's farrowing date. Sows are pregnant on average 114 days, and the breeding schedule needs to be recorded to estimate the farrowing date. Based on the pig's body condition, nesting phenomenon, sows often bite the nest and remove garbage to make a nest. Symptoms: restlessness, walking a lot, not eating. Genitals: 1 to 102 days before giving birth. The external genitalia have obvious changes. The vulva is swollen, flabby, and slightly congested. The nipples are enlarged, and the mammary veins are clearly visible. Colostrum is a notable factor to determine whether the sow is about to give birth. 3 days before giving birth, the udder will secrete clear water. 1 day before giving birth, you can express a few drops of white milk. When the front pair of teats has squeezed out a few drops of colostrum, the pig will give birth just half a day later. If the hind pair of teats can also express colostrum, the pig will give birth within a few hours. In my house, I always prepare tools in advance to assist sows with labor. A brooding box, pliers and scissors to cut off the tail, antiseptic water to clean the mother pig's body if necessary, umbilical cord, clean rag, umbilical scissors, lamp, and necessary medicines. The sow looked very painful and tired, lying on the floor of the barn. I will clean the cage clean, bring a little dry straw to line the nest for the newborn pig, and caress and comfort it. This pig had been in pain for many hours before. It looked very weak, so I decided I would have to inject it with medicine to induce labor. The most commonly used type is oxytocin purchased at veterinary pharmacies. This is one of the drugs that greatly supports the reproductive and lactation process of pigs. Oxytocin is known as a prominent birth-promoting active ingredient in the veterinary industry. Among them, oxytocin has the ability to creates labor or induces labor and effectively reduces bleeding at the placenta. Oxytocin has the ability to cause uterine contractions at different levels, depending on the dose used. Acts on smooth muscles of milk glands and milk ducts to stimulate increased milk secretion in animals. In addition, oxytocin has the effect of preventing placenta retention and preventing mastitis. In the pig industry, oxytocin is known as an effective solution to help reduce the number of suffocating piglets. However, as mentioned above, oxytocin dosage is a factor that needs to be strictly controlled. Oxytocin overdose will lead to excessive contractions of the sow's uterus, rupture of the uterine wall, and blockage, leading to suffocation of piglets, so extreme caution should be used when using it. Only use oxytocin when checking and confirming the cervix is completely dilated, and use a maximum of 2 doses per sow. At this time, it is necessary to create a quiet space so that the mother pig can give birth naturally, as comfortably as possible. Normally, after each strong push, the sow lifts her hind legs, and the piglets are pushed out by the mother. Usually, each piglet gives birth every 15-20 minutes. It takes about 2-5 hours for the pig to finish giving birth, and the placenta comes out about 2-3 hours after giving birth to the last piglet. Or there are also sows that both give birth and give birth to the placenta. When delivering a sow, it is necessary to first clean the sow's rear by washing and drying it to ensure the birthing area is not contaminated. Next, disinfect your hands by washing them with soap and then using alcohol to disinfect, making sure your hands are completely clean and sterile before starting the intervention. During farrowing, pay attention to the position of the fetus. Normally, the fetus will come out in 2 main positions, head down or tail down. The fetus can be born with the piglet's head first, or with its hind legs first. In case the piglet tears its membrane and falls out, you just need to gently pick up the fetus. If piglets are born wrapped in film, quick action must be taken to tear off the wrap to avoid suffocation of the piglets. After tearing off the film, use a clean and soft towel to wipe away the mucus in the piglet's nose and mouth, helping the piglet breathe more easily. Next, wipe the entire body of the piglet and its legs to ensure it is clean and warm. To keep the piglet warm, you can sprinkle Mistral powder over its entire body. In case the piglet suffocates, it is necessary to perform artificial respiration to save its life. The simple way is to use 2 fingers to rub vigorously from top to bottom along the piglet's spine, on both sides of the lungs to stimulate respiratory activity. Another method is to lay the piglet on its back and move its front legs up and down rhythmically. If suffocation is more severe, camphor cardiac medication can be injected at a dose of 1 to 2 ml per piglet. In addition, piglets can be soaked in warm water with a temperature of about 30-35 degrees for about 30-60 seconds to help piglets recover faster. After soaking in water, continue to perform artificial respiration for the piglets. When the piglet begins to show signs of recovery, tie the umbilical cord with thread about 4 centimeters from the abdominal wall, then use sterilized scissors to cut the umbilical cord about 1 centimeter away from the tie. To ensure hygiene, disinfect the cut area with medical cotton dipped in 2% iodine alcohol or methylene blue. Apply antiseptic to the piglet's navel twice a day until the navel is completely dry. Fortunately, all the piglets in this herd were born healthy, and they were breastfed immediately after birth. However, postpartum care of the sow is also very important and requires meticulous attention to ensure optimal health and development of both mother and piglets. 1. Monitor each other after the mother gives birth. As soon as the sow completes farrowing, it is important to monitor the number of placentas that have come out. You should collect all the placenta and put it in a bucket with a lid to avoid contamination. Count the number of umbilical cords of the placenta and compare with the number of piglets born. This will help you determine whether the mother pig has a retained placenta or not. The number of umbilical cords must be equal to the number of piglets born. Otherwise, the mother pig may be having problems and need timely intervention. 2. Cleaning and caring for mother pigs. After the mother pig has given birth, cleaning is very important to prevent infection. Use 0.9% physiological saline and 0.1% potassium permanganate to clean the mother pig's anal rim to clean and disinfect this area. To ensure the piglets can nurse safely and cleanly, wash the mother's udders with warm, soapy water. This helps remove any dirt or bacteria that could harm the piglets during suckling. 3. Monitor mother pig health. Monitoring the health of the mother pig after giving birth is extremely important. You need to check the color, amount, and smell of postpartum fluid. At the same time, monitor the mother pig's body temperature at least twice a day, morning and afternoon, in the first 3 days after giving birth to early detect unusual symptoms such as fever, mastitis, or metritis. If abnormal signs are detected, timely intervention is needed to protect the health of the mother pig and her offspring. 4. Create a suitable nurturing environment. During the time of raising piglets, sows need an ideal living environment to ensure the health and development of their piglets. The cage should be kept warm, cool, and free of drafts. Ventilation and a draft-free environment help avoid stress for mother pigs and piglets. Besides, it is necessary to maintain quiet in the cage so that the mother pig can focus on caring for and breastfeeding her babies without distractions. After the mother pig struggles to give birth to a litter of babies, add adequate food and water to help the mother pig regain her strength. Installing a heating bulb in the cage is also a good way to keep both the mother pig and her piglets warm, especially in the early days when the piglets are still weak and susceptible to cold. 5. Handling cases of mother pigs not breastfeeding. There are some situations where a mother pig may not breastfeed or bite her baby. Common causes include lack of nutrition during pregnancy, mastitis, clogged milk ducts, or piglets that have not had their fangs pressed or that do not have proper fanning techniques. Additionally, the mother pig may become stressed or agitated during the birthing process. In this case, it is necessary to find out the specific cause and apply appropriate remedies to ensure that the piglets receive enough breast milk. 6. Ensure lighting and cleanliness of the barn. Ensuring enough light in the barn is very important to facilitate feeding the pigs, cleaning the barn, and making it easier for the mother pig to stand up, lie down, move, and breastfeed. If the barn is too dark, the mother pig may have difficulty identifying the piglets, which can lead to the mother pig trampling or crushing the piglets to death. 7. Maintenance and cleaning of pig pens. The sow rearing cage must always be kept clean, cleaned regularly, and ensure ventilation, dryness, and warmth. Sows should not be bathed while nursing to limit increased humidity in the cage, but the mother's hair can be brushed to maintain hygiene. If possible, using pig cages with cooling and ventilation systems will create favorable conditions for sows and piglets, helping to improve livestock productivity. Taking care of mother pigs and piglets during this period requires meticulous attention and management to ensure the best health and development for the pigs. Always closely monitor and take necessary measures to maintain the best feeding conditions for both mother pigs and piglets. I would like to extend my heartfelt thanks to all of you who took the time to watch this video. Your support is a great motivation for me to continue sharing useful knowledge and experiences in animal husbandry. Please don't forget to subscribe to the channel so you won't miss any of our latest videos. If you found this video helpful, please share it with your friends and family. Also, we highly appreciate your feedback. Please leave your thoughts or questions in the comments section below, so we can discuss and share experiences together. Thank you very much.